Hey everyone, my name is Katrina. I'm a pelvic floor physical therapist, and in today's masterclass, I wanted to talk about blocked milk ducts. So this is a kind of like a breastfeeding little mini course, and I wanted to talk a little bit about what blocked milk ducts are, how they happen, and just some tips and how physical therapy can help. So blocked milk ducts are happen when there's a tender, sore lump or knot in the breast. It's often a pea-sized lump, and this can happen during any time of your breastfeeding journey. And it typically happens when the milk duct is not draining properly. The reason for this can be due to many reasons. I'll talk about it in the next slide. But pressure can build up behind the clog, making it very uncomfortable, painful, um, and just kind of irritated. So the reason why blocked milk ducts usually happen is because of an oversupply issue. So the breasts are producing too much milk and the breasts aren't being emptied. So there's a lot of milk in the breasts that are kind of building up. One of the main reasons why blockages can happen is just having very poor lymphatic drainage. So your lymphatic system, there's tons of lymphatic vessels and pathways in your armpit, into your breast. And if the body is not doing its job in emptying out all of the swelling and inflammation and toxins, all that swelling can compress the milk duct itself and cause a blockage. Having tightness in your anterior chest wall, so your chest wall right here, can also lead to poor lymphatic drainage. So you can imagine the milk ducts are like freeways. You want those freeways to be open, you don't want too much traffic. If like they're doing construction on the freeway or there's a car accident, for example, that is going to affect the flow of traffic. So same thing, it's going to affect the milk flow. So you want to make sure that those milk ducts have room and that they're not blocked in order for the milk to eliminate. Otherwise, if something is poking on the milk duct or if there's swelling in the breast that are pressing onto the milk duct, then that's when we'll have blockages. Another thing I commonly see is in postpartum moms who have had a C-section, they tend to be a little bit more kind of like hunched over. Possibly they have some C-section scar pain, or they're not able to sit up tall because maybe they're fearful of like stretching out the scar. So if you are, very hunched over, your spine is very flexed forward, that can just lead to congestion and compression in the front of your chest wall, and that can compress your lymphatic system. So we want our lymphatic system, which is all of those kind of little freeways or pathways in green on the picture, to be open, to be flowing well, to be, removing toxins and waste efficiently. Because if the lymphatic system can't do its job, that's when we'll have issues like blocked milk ducts. So if you've had a blocked milk duct and you've tried massage, you've tried hot compress, you've tried vibration, highly recommend seeing a physical therapist, because we can definitely help with that. And our goal during the treatment session is to really improve milk flow. It may consist of very gentle massage around the breast, the nipple, and the areola, depending on where the blockage is. We'll also do lymphatic drainage just to encourage better flow and movement of the lymphatic system, just to make sure we get all the swelling out, all the edema, all the toxins. We may also perform ultrasound. This is not the ultrasound you typically, as an imaging type of assessment. It's a therapeutic ultrasound. So that is deep heat that is delivered to the tissues to kind of break up the clogs. We may also do myofascial and muscle release just to open up the chest muscles to improve lymphatic drainage. Kinesiotaping is also another technique, which is a tape that's applied over the breast in the armpit region to help improve the flow of any swelling or edema that may be present. Edema is another word for swelling. And then just education on optimal breastfeeding postures. So we really want to try to breastfeed in different positions because that's going to allow the breast to empty in all the quadrants. So we have, 4 different quadrants in the breast, and we want to make sure that milk is flowing regularly, efficiently, and smoothly in all areas. Other tips are, again, to see a physical therapist. Do not over massage. So if you are over massaging, being really aggressive, that can actually produce more inflammation and swelling of the milk ducts because these milk ducts are very thin and delicate. They're kind of like veins. So you don't want to over massage the area if you're having a clog, and it can actually make the blockage even worse. You also want to make sure you don't empty your breast all the way. So if you're having a clog and you're really trying to massage it and you're really trying to empty out your breast, it's only actually going to tell your breast to produce more milk. And what we're trying to do is not to produce more milk because there's a blockage that's happening. So if you are having some discomfort from breastfeeding, you can empty the breast maybe about like 20%, but don't try to do 100%. You also want to retrain and re-educate the breast to not overproduce milk. So that's by making sure you're not over massaging, making sure you're not over emptying the breast. And lastly, just feeding in a variety of positions. So that way you ensure all the milk is removed from all the quadrants of the breast. Highly recommend seeing other providers like a lactation consultant and even a chiropractor who specializes in pediatric care. If the baby is having trouble latching, there could be some manual work that can be done with a chiropractor, or even a lactation consultant can help with that as well. So I hope this little masterclass was helpful on just blocked milk ducts, what they are, why they happen, and how physical therapy can help. Highly recommend seeing someone who is trained in treating blocked milk ducts, so like myself, and really trying to seek treatment as soon as possible because you don't want the blockage to get any worse because it could also form into like an abscess, which is a lot more of a serious issue. Feel free to check out my website, email me if you have any questions, and you can check out my Instagram.